Well, welcome everyone to our COVID-19 town hall. My name is Norm Letnick. I'm the MLA for Kelowna Lake Country, and I'm in the traditional area of the Okanagan Indian Band and the West Bank First Nations. All British Columbians in all part of the province are doing their part during this emergency, and I want to thank all our frontline medical and non-medical workers for taking care of our essential health and other needs. And to all British Columbians for following the orders and advice of Dr. Henry and Minister Adrian Dix. It's thanks to all of you and your self-discipline and sacrifices that we have the opportunity to enter a new normal, hopefully very soon. I'd also like to throw out a thank you to Dr. Henry and Minister Dix for their leadership during these past few months, and to introduce them one at a time to bring greetings as well for tonight's town hall. So Dr. Henry, if you'd like to go ahead, please.
Sure. Thank you very much. And it is my pleasure to be speaking to you tonight from the traditional and unceded territories of the Lekwungen-speaking people in the Esquimalt and Songhees First Nations. And I'm very grateful for being able to speak to you from this land. And so thank you, everybody, for today. This is our opportunity to answer questions, and that's what we'll get to very quickly, to try and put some clarity to where we're going with this. But I want to start by just recognizing that this has been an extraordinary time across the globe, and certainly in Canada and here in BC. And we have weathered the first part of this storm, and we've done that because people in British Columbia have done the right thing, and we've all taken care of each other. And we need to continue that spirit and that togetherness, even though we're physically apart in the coming weeks and months.
Thank you very much, Dr. Henry. Minister Dix, would you like to make an opening comment, please?
Well, first of all, I just wanted to say to you, Norm, and to everyone else, thank you for organizing this tonight. I think one of the things that people don't know about as much is the work that members of the legislature have done directly and alongside each other of all political parties, and our work together, the work of Sonia Furstenau from the Green Party, of Andrew Wilkinson, the leader of the Liberal Party, of obviously Premier John Horgan. What we've had in this unprecedented crisis is people working together in new and unusual ways, and I'm both encouraged by that and thankful for it, because it's meant that BC's response has been, I think, consistent and generous across the board. And I think that's very important. And you're organizing this event tonight and organizing other town halls like this with medical health officers across the province has been a big part of that. So I wanted to say thank you to you, Norm. And I want to say that today we announced 23 new cases. Dr. Henry did today, as she does every day, briefing the public that there were 9 from Saturday to Sunday, 14 from Sunday to Monday. And that is relatively few. We had another person pass away, and that's 130 people who have passed away. So there have been significant losses. And I want to appreciate and thank everyone out there for the sacrifices they've made. All those people who have had their surgeries canceled have made sacrifices. All those people who are like me and like many others who aren't able to visit loved ones in long-term care have made sacrifices. Lots of people have made sacrifices, children not being able to go to school. And I think if we've had some success in BC, it's because we work together as communities, both communities of parliamentarians in our sense, but also communities in general. And people have really done an extraordinary job. And I think that's what we have to continue to do. While this is a new normal coming up, we still have to commit to being with each other and supporting each other, because the pandemic isn't going away. There's no vaccine yet, and there's no cure yet. So that means we've got to do a lot together in the next while. But I just wanted to express my appreciation, and let's get the questions going.
Great, thank you. So the way it worked is we asked people to submit questions prior to noon today. We had hundreds of questions, as you can imagine. I've narrowed it down to just let the ambulance pass by. The joys of live TV.
It's busy here in Victoria.
So I've narrowed all the questions came to me, by the way. The government gave me all the questions. I got to select the ones that we would have time to ask. And you also have an opportunity right now, if you're on the Facebook sites. If you're not, you can do that. Go to the Facebook, type in Government of British Columbia. You'll see the town hall. You can click on there, and then you can ask live questions as well. Obviously, we're not going to get through all the pre-submitted questions as well as the live questions, but government has committed to answering all the questions off camera later. So over the next few days, few weeks, everyone should get answers to their questions. So I invite you to come on board, and here are the order of the questions. First, we're going to talk a little bit about the surgical renewal plan. We have a few questions that were submitted on that. Then some general questions on the BC Restart Plan, some questions on gatherings, and some questions from businesses. So these were the general categories that stood out when I looked at the questions this afternoon. So without any further ado, first question comes from Patty. I had a lumbar puncture under X-ray canceled. Will procedures such as that be restarted, or is that a low priority when it comes to surgeries?
Well, I'll give that a try. Maybe Dr. Henry will have some things to say as well. The key will be to contact your referring surgeon, but in this case, we're contacting everybody, and so I wouldn't assume that you would have a lower priority necessarily. What we're trying to do to improve our response is add hours and add days, including weekends, as well as enhance the capacity we have in the contracts we have with private surgical clinics. So we're working hard to make up the ground, and it's a lot of ground to make up. We've canceled about 30,000 surgeries, or we will have by the middle of May. We're also, and we may talk about this later, there's also referrals that haven't happened that will have an impact on wait lists. So we've got to get going, and we have to do so even though with COVID-19 protocols in hospitals now, we're a little less efficient. We have to take more time to protect patients, more time to protect healthcare workers and doctors and nurses and so on. So I would not assume that. I would say that we are going to very vigorously work to reduce those wait times. It's going to take a long while, but if you are on the wait list or we're waiting for surgery and had it canceled, you should expect to hear from someone from your health authority soon and start the process of getting your surgery back online.
So
I'll add to that because she was talking about an LP, a lumbar puncture, and that's one of the diagnostic imaging that also has been on hold for many people, depending on the reason why you needed that. So again, these diagnostic imaging procedures will also be ramped up, and we know it depends on why you were scheduled for that in the first place. So to go back to what Minister Dix said, the first thing to do is contact your care provider and determine whether it's still needed, and if it is, then making sure that you get back into the list once the diagnostic imaging starts going again.
So those are great answers, and actually leads a good segue into two other questions that we got today. One is, will citizens or their advocates, like their care provider, who disagree with the assessment of the urgency of their particular procedure have an avenue of appeal? And in the past, when your care provider was advocating for you, sometimes they would contact their MLAs and try to get advancement. Is there a better way? Is there an avenue of appeal beyond their care provider so they can make their case that their particular medical need is actually greater than they've been assessed at?
So the people involved here in the decisions will be surgeons, but each health authority will also have clinical teams to set priorities. Sometimes people think, well, my surgery may be seen as less important than others. We've done probably by May 15th, we'll have done about 20,000 urgent surgeries during this COVID period. So those surgeries are roughly up to date, although there will be some work to be done there. So yes, there's the place you can go other than talking to your doctor and your surgeon is also, if you have a concern about where you're placed or decisions been made, you can make a case to the patient quality review board and raise your issue yourself as well. This was an independent process that was set up, I think it was 2008, 2009. And during the time when George Abbott was Minister of Health. It's been around for about 10 years. And it's a place for people to go where decisions of health authorities can be independently reviewed. So if you've got concerns like that, there is a place to go. And that's the place we have it to go. There's no, sometimes people call me and they say, well, can you change that? And the answer to that is no, I can't change that. Those decisions have to be made by clinicians. But there is a place to go if you have concerns about how the health system's treating you or the priority of your case.
Okay, thank you. So one of the live questions that just came in relative to this topic is Nico would like to know when doctor offices will be open again for examinations or appointments, not virtual meetings.
Yeah, so that's something we're working on with all of what we call the regulated health professions. So doctors, dentists, massage therapists, nurse practitioners in the community. We're working on the process for them to increase the one-on-one contact that they have in their office and how to do that safely. And of course, one of the key things is making sure that they have the appropriate personal protective equipment that's needed for safe visits in offices. But you can expect to start to see that increasing in the coming weeks as well. But it will remain a mixture now of virtual care and in-office care. And there'll be different strategies that different communities of family practice will be doing, for example, in different parts of British Columbia. But that will start to become more common in the next few weeks as well.
Thank you. And one more question. I believe, Minister Dix, you talked about surgery wait lists. This morning, the Globe and Mail wrote that 93,000 people were on surgery wait lists prior to COVID. Do you have any idea what the current number is before we implement the new strategy?
So that number came from the presentation I made when we put forward the new strategy, I believe, and we provided it to the Globe and Mail. It is about 93,000 because the 30,000 we canceled were already in that list. But I think the thing we'll have to look at in the month or two to come is how many people who would ordinarily of this period been added to the wait list, who aren't on the wait list now, but would have been referred. In other words, we estimate that number to be about 24,000. So we'll know in a month or two where the wait list stands in full. Mm-hmm. And what we're trying to do in BC, it's a little different than other places, is we're going to try and aggressively address this. It's not just relaunching the surgeries. We have the idea and the plan is to increase our capacity for surgeries so we can reduce wait lists, and we'll be over 17, 24 months get back to where we were, this massive increase that we faced because of COVID-19, and then continue on so we can improve services for people. And I think that's very important. It's about maximizing everything we can do in the public system. And I think that's going to involve bringing some new people in, for hiring new people, including everyone from the people who organize the booking of surgeries, to surgeons themselves, anesthesiologists, to nurses, to health sciences professionals, everybody. But I think it's the task we need to do. I think it's what we owe to people who had to make this sacrifice, and not just the 30,000 that were canceled, but all those others who are behind them on the wait list, who are also waiting for surgery.
Thank you. And the last question for this section, amazing how fast the time goes, right? We've almost done 15 minutes already. When will I be able to visit my immediate family in the hospital? I just had someone who had a stroke over a month ago, and I really would like to go in and visit them.
Yeah, I think, and Dr. Henry can talk about this. I think we were talking at the same time, but just say, this is something that we really feel for people. This is true in long-term care as well, and in acute care. And right now, it's our assessment that it's not safe enough to do that yet. I know someone in a care home with 195 beds, and having different people going to all those beds when the risk is so high right now is too high. But it is a serious problem because everyone who's in long-term care or this family, someone who's in acute care who's there for a long period of time, a long duration, recovering from such a difficult condition as a stroke, I think we know what people are losing and all that. So it is an important priority. But right now, we need to be safe, and part of the way we stay safe is to avoid outbreaks in hospitals. It's part of the way that we can get on with surgeries right away. We have 3 outbreaks in BC in acute care hospitals right now, one in Lions Gate, one at Ridge Meadows, which is in Maple Ridge, and one in Richmond. And we also have 20 active outbreaks in long-term care. So that's a serious situation. It means in spite of the costs that we recognize, we're still going to have to wait a while longer. And I know Dr. Henry will have a couple of things to say about that as well.
Mostly that we absolutely recognize the challenge and the importance of having family to help people stay well if you're in long-term care, but also in acute care. And we are looking at what are the conditions that would allow us to have at least one family member come in to spend time with their family only. And that is something that we have asked the long-term care, particularly homes, to look at in the future, but we're not quite there yet. We need to make sure that we can keep everybody in that community safe. And that's the important part right now.
Thank you very much to both of you for your answers. So on the BEC restart plan, we have some general questions. One is not to excuse, this is from numerous people actually, not to excuse the need for physical distancing, but would it not be very wise for everyone to start wearing a mask?
Yeah, and we've talked about that a little bit earlier today, but our concept and our ideas of the purpose for a mask have changed a little bit in terms of our recommendation. Certainly that's because we've understood more about how this virus can be transmitted. But I want to start by saying right now we still have a challenge in getting medical masks and respirators for the healthcare workers who absolutely need them in our healthcare system, not just for caring for people with COVID-19, but for caring with other people who have other infections that can be transmitted in our hospital setting. So non-medical masks, or for medical masks, we need to keep for our healthcare sector. Having said that, there is a place, I believe, for non-medical masks in our new normal for the coming months. And that's in those times when we can't always maintain that physical distance consistently over time. So places where we might be in a crowded situation where we can't maintain that distance. So on transportation, for example, on the bus, if it gets crowded suddenly, or if there's not physical barriers in a place like the grocery store where you might come into contact with people. But I think we need to also remember that that wearing a mask is not to protect me from everybody else. It's to keep my droplets in. So that's really important. And if I'm wearing a mask to keep my droplets in, and somebody else is wearing a mask to keep their droplets in, then we're both protected. And so it's something we do for others, not for ourselves necessarily. And that's something we should be thinking about in those short-term situations. So we don't want people wearing them all day long in schools, in places where they can get soiled and messy and we fiddle with them, and that can cause more risk. But those short-term places when we're out and in the community and maybe crowded, we may not be able to keep our distance. There is a place for non-medical masks.
Thank you. Carrie Ann asks, in light of the new reports from the United Kingdom and New York over children dying and needing ICU to survive after contracting COVID-19, is it premature to expand school and daycares right now?
Yeah, so I think there's a little bit of a mix up there in that there has been come to light very recently that some children may contract an inflammatory condition that's very similar to something that we've known for a long time called Kawasaki disease. And it's not clear yet if it's related to COVID-19 or not, but it's likely it could be. It is a condition that we've seen that causes inflammation of the blood vessels. It can cause red eyes, conjunctivitis, a rash, a skin rash, sometimes swelling of the tongue, and some children can get quite sick with it. Where we're seeing some differences is not everybody who's had every child who's had this phenomenon in the last few months, either in the UK or in New York, where they've reported it as well, have actually tested positive for COVID-19. And we know there's other viruses and infections that can be associated with it as well. So there's a lot we still don't know. I think the other really important thing is it's still very, very rare, and it tends to happen in older children. So we still have very low levels of transmission in children in BC, in Canada, and across the world, and particularly for children under the age of 10. Older children do tend to get a little bit more serious illness, but and can be requiring hospitalization. And here in BC, we've had 3 children under the age of 19 who've been in hospital, but we've had nobody who's needed to be in the ICU, and there's been thankfully no deaths in children in BC or in Canada.
Karen asks, after hearing much about the dangers of being asymptomatic carrier of COVID-19, how do we safely add any person to our bubble, not knowing if we are a carrier without symptoms?
Yeah, so that's been part of the challenge that we've had as we've learned more about this virus, and the fact that some people may not recognize that they have symptoms, or may not, or infectious to others early on before they show symptoms themselves. And it is still quite rare. We don't know how much spread, but we also know that it is in that close contact. So when we're in environments where we're spending time with people, so 15 minutes, half an hour, longer, that's when, indoors in particular, that's when we're much more likely to spread it. So we need to be very cautious ourselves. If we're feeling at all unwell, we need to stay away from others, and we need to take those physical distancing measures to try and prevent any transmission that we have. Having said that, most of the transmission is from people once they have symptoms, when they're in close contact. So that's why we need to be very, very careful about that. And we need to go cautiously when we're expanding our bubble, when we're including other people in our close contacts in the next couple of weeks. We need to do that cautiously and carefully, particularly if we're people who might have more risk factors for getting sick ourselves and getting severe illness with them. Older people, we don't want to be expanding our circle right now. People who have heart disease or lung disease, or who are going through cancer treatments, this is not the time to invite new people into your contacts. This is the time where you need to continue to take these measures to stay safe, and the rest of us have to support you in doing that.
So let me add one more in there if I can. If I'm, and I did this weekend, welcome my grandchildren into my social bubble, which was great after 2 months. Following your advice, Dr. Henry, you said I could expand a little bit.
Until next weekend.
Oh, next weekend. Okay, well, I'm guilty as charged. Guilty as charged. But I told my grandchildren's parents to stay away. Is that the right approach, or the fact that I brought in my grandchildren really means that their parents are part of my bubble now too?
Absolutely, they are. And this is the concept. You have to realize that we're in contact with those contacts of our contacts as well. And that's why we have to be careful about this. So yes, if you want to expand your family, and we were talking about, coming up next week, and carefully and thoughtfully. So if you have somebody and you want your grandchildren in your family, then your children are there too, but you need to be careful. So you may not want them to have a dinner party with your neighbors, or make sure that you keep your distance with your close friends with. We want to be judicious in how we do this, so that we're not in those situations where you have lots of people congregating together, and that one person who may have been carrying this virus then is able to spread it to a whole bunch of other people, some of whom can get very sick with this.
Right, thank you. Question from our live Facebook feed is from Jennifer. Will you be monitoring how outbreaks are being handled in Montreal and Toronto with regards to daycares, and how that will affect phase 2 of BC's restart plan?
Yeah, absolutely. And this is something that we talk about regularly with my counterparts across the country. And there have been some daycare clusters in Toronto and also in Montreal, two of which I've known about. And we're looking at those. I mean, the good news is that there's limited transmission, and most people have very mild illness, as we've been seeing with children. So there's a detailed investigation ongoing in both those situations to try and find out, was it an adult who passed it to the children, or was there transmission between children? And that will certainly be important for us in looking at what measures did they have in place to protect kids from transmitting to each other, or the staff or parents from transmitting, and making sure that we have the right things in place in our care centers here.
Jacqueline says, her question, when will international travel resume, please? And I think she means it more, I don't want to make an assumption of us going elsewhere, but it could be also people coming to British Columbia. Does international tourism in phase 4 of the restart plan encompass both travelers coming to BC and BC residents planning to travel abroad?
Yeah. And
Well,
uh,
go ahead, sir.
but then I'll turn,
Yeah, no
part
worries.
is not in our control because we know this virus is causing outbreaks around the world. And so much of the international travel that we're seeing that we're not seeing anymore is because many other countries are dealing with this and they have stopped travel as have we. So I do not see in the short term that we will be lifting the restrictions that we've put in place here in BC of people who are coming into BC from the US or from other countries around the world. So as people know, we do have an order that requires people to self-isolate for 14 days, and we have measures in place to greet people at all of our land and air borders and make sure that they do have a valid plan that works and that we can support them in doing that. So that's the important thing, that we are able to support people and make sure that they get what they need so that they are effectively able to self-isolate. And I will say we've been doing that since April 10th with the extra measures that BC's put in place. And we've had a number of people who have developed COVID-19 while they've been in isolation. And that's okay. That protects us. And we are able to make sure they get the health care that they need and that they're not spreading it to anybody else. And I know, Minister, you probably want to say.
Yeah, just to say all of that, and just to say, obviously, that international travel involves the federal government. We've strongly advocated they continue to have their restrictions, not on essential travel, people like truckers who would bring essential supplies to BC, but no to visitors from the United States and other jurisdictions right now. And that's true for Canadians traveling abroad as well. And for Canadians returning home, which is the main number of travelers we have right now who are coming home from whatever travel they've taken place, they have to do the 14-day self-isolation. And I don't see that changing anytime soon. And we're going to continue to advocate with the federal government to continue those restrictions, because this is, as you've seen, develop over time. The ability for COVID-19 to take hold and to spread happens quickly. And we've seen this in a number of cases, even in the last 2 weeks, as BC has been flattening the curve. So it continues to be necessary. So unfortunately, for people who like to travel, which is lots of people in BC, they're going to have to wait for some time, I think.
Yeah, I include myself in that. I really miss travel, which is something.
Yeah. All those who don't like to travel, put your hand up.
That's exactly.
I think there's a role for family reunification, if you will, across our border with the U.S. And we have been talking with our counterparts at the federal government about how to do that in a safe way.
Yeah, and the restart plan is so important because a lot of people have lost a lot of income and might not be able to travel these days anyway. They don't have a job, and we have to get the economy going as safely and as quickly as possible.
And I think, Norm, just the one thing I'd say too is it shows why we have to continue to be, as we restart, there are still going to be rules around physical distancing, why it's so important that we continue to follow that, because you don't get to phase 3 if phase 2 isn't successful. And so we have to continue to follow what Dr. Henry and many other people in public health are telling us to do.
Thank you. Teresa from our Facebook Live would like to know, when will an antibody test be available? I'd like my teenagers to be tested, as both of them had symptoms that are noted for COVID-19. Fever for days, chills, bluish coloring on their face, lips. The hospital sent one home saying it was just the flu.
Yeah, well, it's not just the flu. I can tell you that we had a lot of people with influenza this year, and it also can make people very, very sick. And that was one of the reasons why it was hard to tell early on if people had influenza or COVID-19. And I will say, when we were doing the testing for both, but of 100 people that we test, one of them would have COVID-19 and 20 of them would have influenza. So it's not to minimize influenza. And that's, of course, one of the things we're concerned about going into the fall next year. Having said that, we do not yet have a valid serology test that we feel is ready for us to use to see if people have antibodies. So if they had been infected, the BC CDC Public Health Lab is doing lots of testing, as are the National Microbiology Lab in Winnipeg. And there are a couple of good candidates. I think I mentioned this the other day, that we're doing some more testing on. What we need to make sure, So all of these tests, some of them, they have what we call false positives and false negatives. So we want to make sure we know what the parameters are so that we don't have a whole lot of people that we falsely say are immune when they really aren't. So that's the importance of this test. Having said that, we also have a strategy for how we can look at who in the population was infected in the past. So stay tuned. It will be coming. It won't be this week, unfortunately. I was really hopeful that it would be in the next last week or this week, but it will be in the coming weeks.
Thank you. When will I be able, this is from Michelle, when will I be able to travel within British Columbia, i.e. to my cottage?
You want to take that one?
Oh, go ahead, and then I'll follow up. But
I was just going to say, that is also something that we think is important. Right now, we're really telling you to stay close to home. That helps relieve the pressure on communities that are smaller, that may not have resources to be able to look after people if they get sick. It may make it challenging, as well as, we know that there's been delays in some of the essential supplies getting through to some of our smaller communities. So we need to be aware that if we go in and make long lineups at their grocery stores, that affects people. So right now and for this weekend, pick the park that's close to you. Go outside and around where you are in your neighborhood. But I do think this summer we'll be able to expand our travel. And I think this summer is something it's going to be a really unusual summer for all of us. And we need to think about BC and enjoying where we are and enjoying BC for BC.
and just to add to that, this week again, I'm going to be talking to and working with Alberta Health Minister Tyler Shandro to talk about travel between our provinces. Again, I think it's really important that this weekend, as we move perhaps from phase 1 to phase 2, as we're talking about, and moving in that time, that we really this weekend enjoy it together, enjoy it close to home, and make a special effort to keep flattening the curve of COVID-19 this weekend. I think that's really important. That's something that we can do for each other. There will be opportunities to go to your cabin or to your second home, or to see people elsewhere in BC in the summer. But right now, I think it's really valuable to stay close to home, and that's what we're asking people to do.
Thank you. Many of us have self-isolated following your leadership. This one came from a lot of people. Why is ICBC not giving us a financial credit during the state of emergency?
I got to leave that to Dr. Henry. No, I'm just kidding. I think obviously this is something people are interested in. I think my colleague David Eby is going to lay out and present the evidence about what's happened at ICBC soon, so everyone can see it, and then people can have the discussion about what should happen at ICBC. What we've tried to do on the health side is do just that. So when we have really difficult decisions to make, like the one canceling surgery, like the one limiting visiting in long-term care, which are really profoundly difficult decisions for people, what we tried to do is just lay out all the evidence first. And I think that's what Minister Eby is going to do around ICBC, and then people can have the debate.
I will say that from a public health perspective, one of the things that we do monitor, and I put a report out on this a couple of years ago, is motor vehicle crashes. And motor vehicle crashes have been down in the last few months, although there have been a number recently of deaths, unfortunately, from motorbike accidents and crashes and car crashes.
Thank you. The last question for this, because we're halfway through already. This section is the 30-day prescription renewal. This is from Barbara, is now not in effect, and we can get 3-month renewals, but the dispensing fee is now higher. Any idea why the increase?
The pharmacare fee is the same, but what I would suggest in Barbara's case is if she'd send her information to you, or we can arrange, I'd be happy to take a look at her circumstances. So pharmacare fee has stayed the same for a long time, but there are differential fees sometimes charged out there. So I'd be interested to hear the information she has. Also, if people are struggling, if they've lost income in this time, all of us are part of Fair Pharmacare, but you can get the income reassessed if, for example, you've lost your job or lost significant income and are also have a chronic disease, say, and use prescription drugs a lot, you can get your deductible reassessed, which is important. And there are ways also to smooth out deductibles because, as you know, I have type 1 diabetes, so I know about getting prescription drugs through the course of the year. And early on in the year, we're all inside of our deductibles, whatever they are, for quite a long time. Some people may need that smoothed out, and they can do that. They can do both of those things by contacting MSP, and they can find that on the government website, the number.
Thank you. Well, so the next section is about gatherings. We got a lot of questions on gatherings. So there is a provincial order by yourself, Dr. Henry, on the 50. I understand from reading the media that some restaurants are planning to open very soon, should they be able to meet the requirements, the plan that they've submitted. And one of the features is to reduce their capacity by 50%. So we have in Kelowna, for example, in the media today, there's a restaurant that says they're going to open with all the social distancing, moving the tables and everything else. And they're going to have 75 people in the restaurant. So the overall question, if you look at gatherings and all the questions I'm going to talk about here is, if the limit is 50 and you have restaurants, which we need, as you've frequently said, that you have your own favorite restaurants, does that mean that you can hold a social gathering of more than 50 in a place that has been approved for more than 50? So again, the example is the restaurant at 75. So when I ask you in a minute, I have a wedding here by Soup Dev that has 60 people. I'm not allowed to hold a gathering of 50 or more, but if I hold it in that restaurant that's been approved for 75, can I now have my wedding, right? You see how this can be confusing for the general public. So, so please, if you can provide some clarity on this, because I know there's a lot of people out there that want to do gatherings, not only weddings, of course, but all our event organizers are struggling because the lack of events. And all the other parts of the economy are wondering if there are areas, just take an extreme, BC Place, for example, can hold tens of thousands of people. Are they also limited to 50 people, or can they submit a plan that would be approved by whoever that says, yes, you are following all the health protocols and therefore you can go ahead and do events subject to those health protocols, but it's over 50 people. So I'll just leave it there and get a general answer from you on that.
There's a couple of things. The 50 people is about gatherings. It's not meant to be if you have the large hardware store or the large grocery that you have to limit it to 50 people. It's not for businesses. And there are some situations where restaurants would clearly be able to seat people that are above 50. But that doesn't mean that they're all one gathering. So it's small groups within that restaurant. Not that you have one big table with 50 people at it. There may be one big table with the maximum of 6 or 10 people at them. So it is not meant to apply to businesses, but there are restrictions in numbers of people who congregate in a business, and you have to have that physical distancing between them. So yes, that it is slightly different, but there are also other restrictions for how businesses can run if they're big enough to hold more than 50 people in terms of gatherings. So we're talking about events like concerts, like sports games, like weddings, like big parties, big celebrations, even events like religious meetings and funerals that happen where people come together. Those we know are risky right now. We know that there has been transmission quite extensively sometimes. We've had people in this country where we've had a birthday party where people have become sick. Many people have become sick and people have died. So those are the types of occasions right now that are risky. So they are absolutely under 50. So no, you can't have a wedding with 60 people in a restaurant all together like that, because you're putting your family at risk. And that's what we have to be aware of here. What we're looking at is, we say 50 for certain events, but that means you have to space people out. And it may not be appropriate in every venue. So if you're outside, yeah, so we could have a kid's baseball game with fewer people watching around the stands. So the parents would have to maintain their physical distancing, and we put some changes in place. But it doesn't mean we can have everybody gathered together in one place, unfortunately, right now. And there's other restrictions that we need to have in place. So if we're going to have a wedding, it definitely has to be under 50. And if it's outdoors, you can space people apart. That's good. But you can't, we don't want buffets, because we know those are places that you can also transmit this virus. So you have to look at things a little differently. And you have to be careful about people who are older and more at risk. So what I would suggest to people is having small intimate weddings and looking at having those combinations of parties or celebrations or weddings or funerals that we have seen where people, particularly if they're older and more likely to be have severe illness with COVID-19, where they can participate remotely. And there's many innovative ways we can do that. And I would love to be able to say that this is something that we can get rid of at some point, but I don't see it happening, at least not this summer. So I think we need to start now about making plans about how do we have those small, intimate gatherings that protect our family, protect our communities.
So I don't think I need to ask many of the other questions. I think you answered most of the questions on the gatherings with the one answer. But just to be clear, so before I skip to the next part, if a restaurant is approved for more than 50, again, 75 is the example, and they set up their tables so they're all separate as per the protocols. If I want to book the restaurant for one event, subject to them all sitting according to and being monitored by the restaurant management at the different tables, are you saying that no, that is not permissible if it's one group, like a wedding, for lack of a better example?
I can't see a wedding where people keep their distance in a restaurant like that.
So that's the issue.
No, I think people have to use their dare I say common sense. You have to make those decisions for yourself. As a restaurant owner, if you can keep people separated so that you're protecting your staff as well as your customers, that's really important as well. And that you're able to keep people at their tables, and so they are separating from each other and doing all the appropriate things so that this doesn't take hold. And there's a really great paper that was just published around a very similar situation where there was a birthday party at a restaurant where somebody who unknowingly had a very mild illness, didn't realize, but was highly infectious. And you can see exactly which table people sat at and how it was transmitted. So, these are just the things that are dangerous right now in terms of the virus and spreading this. So I think people need to take that into account. We don't want to be spreading this to our friends and family. And those are the people that we're closest with. Yeah,
no, I agree with you, Dr. Henry, about we don't want to be spreading it. You should have seen all the questions that we got today about this one issue. It's just, it's on the top of everyone's mind, especially with the nice weather that's coming and the restaurants are going to be starting to open up. So another question, and I think we've used up the gathering piece. So we'll switch over to some business questions. When can activities like ballet and dance start?
Yeah, good question. All of these recreational things that people are into, we don't have all the answers yet, but we're looking at it, and they can happen, I'm sure, but they will need to happen in terms of small numbers, maintaining distance and space. There's some things that are more risky than others, like choirs getting together and singing. That's something that you're going to have to find some way of doing separately. Zoom choirs, there's lots of good stuff going on around that now. But we know as well that people can unintentionally pass this virus when they're standing next to somebody closely and singing. And we've seen that happen in choirs. These are the things that we've learned over the last few months. Ballet, dancing, gymnastics, smaller numbers, keeping your space, having smaller numbers in an enclosed space, doing outdoor. I'm looking forward to maybe having my outdoor yoga classes where you can keep your distance and still participate. Those are the types of things we need to think about through the summer.
So we had a question from the Facebook Live. Thank you, Susan. Kind of a business question as well as a consumer. When can we start using our reusable shopping bags at grocery stores again? Is the risk of the virus transmission so serious from these bags that we should be continuing to put more plastic into our environment? Thank you, Susan, for that.
I am with you. I actually am not entirely clear where that came from, but it has been guidance that's been ascribed to me. So that has happened not just here in BC, but across Canada and in many places around the world. I think it is, to me, the basic principle is very similar to handling money, handling anything that you bring into a situation like that. It is, you need to clean your hands after you touch it. And so we now know that we have cleaning available. The cashiers as well are cleaning their hands. I can see how it can be challenging if you're putting your bags that you brought from home on the belt, and the cashiers are feeling they're at risk filling your bag for you. So yeah, keep it in your cart. Put the contents in yourself. But I think that's something that we can look at modifying, because I absolutely agree. I don't think, well, one, we don't want any plastic bags, but also even the paper bags are probably not necessary.
So this is go ahead.
I think the key to this is also to keep things to show good hygiene, and this is really important with non-medical masks. I think these are things that have to be washed all the time if you're going to be using them at all. And this is true of things such as bags. I think that we're going to have to just all of us, and this is mostly self-directed at this table, clean up our act in some of those ways and make sure that we keep surfaces clean, that we show good hygiene in general. And that's true of all of these things. So I think some of this, there'll be less specific rules, but more a general rule that we take that extra step right now to keep things clean and to make sure that we keep our hands washed at all times.
Yeah, absolutely. But that, okay. I will say as well that people don't realize the effectiveness of some of the what we call engineering controls. So those plexiglass barriers that they put up in at least grocery stores that keep me separated from the line behind me, but also keep me separated from the person at the till. Those are very effective barriers. You don't need to be wearing a mask if you have that type of a barrier that keeps my droplets from your droplets or from your face. So those types of things are simple and effective and are very helpful in many different situations.
I look forward to going to my favorite Japanese restaurant that has a lot of separate little places to eat, right? Speaking of restaurants, we have a question from Reg. When will full service restaurants and pubs be allowed to open? I think he's looking for a date. And how many customers will be allowed in each location? I think we addressed that second question, but would you like to answer that?
So we are working out the details of what needs to be in place to make sure that it's safe for staff. And that's a really important thing as well. Sometimes in the kitchens, you have many people that are very close together, the serving staff, as well as safe for customers. So the potential is there starting on the 19th after the long weekend. But I expect early on, at least, there'll be some hybrid of reduced seating inside with appropriate barriers, with distancing that's possible, and continuing perhaps outside patios. As we've said many times, the outside is safer as long as you're able to maintain that distance, and we're lucky with the weather here. But what it needs to do, everybody needs to have a plan. So every restaurant needs to look at their own situation and develop a plan that meets the criteria. And WorkSafe BC and the Restaurant Association, we've been working on that. And that will be hopefully up for people, the more specific directions later this week. And you can start, but you need to, we've given out the basics, so a restaurant can start thinking about whether this model will work for them. And every situation is unique, and it may work for some, it may not work for others, given the physical layout and the people who are involved in the restaurant, and all the unique situations for each business.
To both of you, you've done, sorry, did you finish?
I just said the potential is for some restaurants to start early next week, but it's going to take time for people to really look at their own situation and see whether it works for them or not.
Right. Just apologize because sometimes with the Zoom it fades out and I think you finished the answer and boom, I interrupted you. So I apologize for that. To both of you, you've done an excellent job in leading our province, and I think people have done, apart from me, of course, with my grandchildren, as I've disclosed, an excellent job in following your recommendations and your orders. But there are 5 million people out there, and there probably are 5 million different opinions as to what is right and what is not. Given that, how can the public, this is a question that came in, how can the public get timely, actionable, and consistent answers to their many questions? There seems to be in the plan, the restart plan, a deputy ministers committee of 3 that's looking at things. We have, of course, the Ministry of Health. We have local provincial health officers for each of the health authorities, plus yourself. We've also been told to go to WorkSafe BC, and the Premier, of course, told people to go to their MLAs last week, which I'm sure he'll be discussing maybe tomorrow night at his town hall. With all these different bodies, and 5 million people with different opinions as to what works and what doesn't work, what can people do to get answers to their questions in a timely manner, so that they're doing what is right? Because no one wants to be in trouble, or against the law. So, whether in practice or in spirit. So what can people do when all these businesses, when they have all these questions, they can't come to their MLA? With all due respect to the minister, he and I aren't clinicians. We're not doctors. We're politicians who are trying to serve our communities as best we can. But our constituency assistants don't have the answers. Deputy ministers team, is that the right place? Is it WorkSafe BC? And it can't just be a hodgepodge, because people will go to whoever they think will give them the answer that they're looking for. So can you help us, both of you, on this one?
So let me try it for a few things. First of all, 811, which has been important. You remember early on in March, we were really tested with the number of calls we received, but in the last 30 days, wait times have been under 30 seconds. So if you've got medical questions, what a good place to start. You can get access now. Yesterday, I think we dropped 4 calls out of about 2,800. So there's a good place to start. If you're a senior, you're looking for support in your community and you're living at home, there's a 211 number. And if you'd like to volunteer for seniors, 211 is a good place. That's for different things. One for medical, one for seniors. We have a number called 1888 COVID-19, which is for general questions about all COVID questions that aren't medical questions. And so those are all good places to start. There's a number, and I should have memorized it and I didn't, at WorkSafe BC, but you can find through those numbers that they would connect you with. If you actually want to talk to somebody, there is a website that gives a lot of information about the startup plan. But if you want to talk to someone at WorkSafe about your plan, or even have someone assigned, you can do it through that number through WorkSafe BC, and we can provide that maybe after. So those are key places to go to do so. And as you know, through this process, MLAs have been very responsive, and my office tries to do that, and working a lot with your office, Norm, and has, I think, answered a lot of people's questions over time. But you're right; those other places are good places to go. And so, if you're not succeeding in those places, I would say about MLAs, if you're not succeeding in those places, and there's a structural problem in the way we're responding, then I'd say let your MLA know. And I know that if it's a health matter that we talk just about every day, and you'd be able to raise it with me. So those are some of the places to go, because the questions and the people you want to talk to about medical matters are nurses, and that's what you get at the 811 line. But if you have questions about your business, the WorkSafe number or the general COVID-19 number are the places to go.
And I will say as well that this process is an evolution, and there's hundreds and hundreds of thousands of businesses. So no, we can't approve, and we don't expect to approve every single individual plan. But what we've been doing is working with the different sectors And so, yes, when there's a leader in that sector who's involved, even if not everybody is part of that group, and I'm talking about things like the Restaurant Association, that went through this with in the construction industry, and WorkSafe has been involved. And what we have is a partnership right now between public health, and we have a committee that includes our environmental health officers. So they're the ones who do inspections of restaurants and daycares and food premises, and our poultry production facilities and cheese making facilities, whatever. And so they have been involved with WorkSafe to come up with guidance, and more specific guidance will be coming up and will be on the WorkSafe website this week. And we'll go from there. And if you are, and what we have required as part of this restart plan is that businesses have public posting of their plan. And that's the piece that keeps us all accountable, so that employees know what the plan is. So you have to have a plan. Employees need to know what the plan is, and your customers know what the plan is. And if you are an employee who has concerns that the plan is not being followed, or there isn't an appropriate plan, then WorkSafe is the place to go. If you are a member of the public that is concerned that there's risky things happening at a business that shouldn't be happening, or that they're not following the plan, then you can complain to the public health, your local public health, and we'll be assessing, prioritizing, and working with WorkSafe to see who needs to do an inspection if that's required, or investigate the complaints.
And the final thing I just say is, I'm going to steal one of Dr. Henry's best lines, but let's be kind to one another during this period. I think that's important. One of the reasons we've succeeded in BC and done so well is people have been that way, and there's frustration sometimes. People who feel they're following the rules and other people aren't. But we have to help one another get through this time, because it's going to take quite a bit of time into the future. We're going to have to live together over that time. That's why, sometimes people want us or other people to punish somebody for not following the rules on a particular day. We've got to live with this a long time. And I think we can get there together and encourage one another and support one another in this time. And that's what I really encourage people to do. And that's why we're trying to empower people in BC, both business and individuals, to do what they can do for one another at this time.
Thank you. Just a couple more questions before we wrap up. Adam would like to know what your comments would be on the 10,000 plus hairstylists that have signed a petition asking to be removed from phase 2.
Yeah, so I would say I've been inundated with people who both want to be opening as soon as absolutely possible, and people who say we can't possibly open. So please don't send them to me anymore. Process, and you need to make that decision yourself based on your business, who you are, whether you're somebody who is vulnerable to the COVID-19, who your clientele is. And so if you're a larger salon that has a lot of older people, or people who have their business is going into long-term care homes, for example, well, you're not going to be able to start your business in the next little while, because that's not going to be able to fit into the restrictions that we have. But if you're an owner of an operator of a salon that's able to take appointments, make sure you have physical distancing, put in place the measures to keep you and your customers safe, then we can look forward in the weeks to opening up in some of those places. But it's going to be on a smaller scale, and every business has to look at their own way that they're working and how it can be safe for them.
Thank you. And the last question, and just as a reminder, all these questions that haven't been answered are with the ministry and the government, and their intention is to answer every one of your questions. So just because it didn't get on the air tonight doesn't mean it won't get answered. The last question is, can churches, and this is from Wynn, can churches offer drive-in service on their parking lots or fields?
Yeah, and there has been some of that happening, I know. And the shorter answer is yeah, sure. That's a way of innovating. If it works for you, smaller numbers, we still need to think about having your own household in your car, not having a carload of people that's all your neighbors. And so putting into place those common sense or uncommon sense measures to make sure that, the purpose of this, and we have to keep going back to them, The purpose of this is not to give this virus an opportunity to spread widely between us and wildly between us either. So we want to make sure that we're doing what we're doing to protect our loved ones and our family and our community, because that's who's going to get sick with this if we bring it home.
And we've been blessed, Norm, in this province with religious leaders that have really been extraordinary around the province and supporting the people in their congregations, whatever their faiths. And I've been inspired by their innovation, their ideas, and we're going to have to continue to be that way, to operate and to support one another and to love one another in what's going to be a very challenging period ahead of us.
So at this point, I just want to give both of you an opportunity to say a few final words. It sounds like you just did it, but we'll do it again. Let's start with Minister Dix, please.
Just thank you to you again, Norm, for organizing this. This is something that we've done together, but we've done these kind of events around BC with MLAs of all parties around BC and medical health officers. And this was really your inspiration. I just wanted to say thank you once again for all you've done, and to thank all the people out there for all their support and their caring for one another, their kindness to one another over the last few months.
Thank you. And Dr. Henry?
Well, I'd echo that. Thank you very much. And we have come through this, the beginning of or the end of our beginning, perhaps. And we've come through this because people in BC recognize that we can get through this together by caring for each other, by being compassionate, by being patient. And we need to continue that in the coming weeks. It's going to be a very different summer for all of us, and we will get through it. And it is not forever. It is for now, and we need to do our best to support each other through this and to protect those who are more likely to get severe illness with this virus. And we do that, as I say every day, by being kind and being calm and being safe.
I'd like to end by thanking Nigel Howard, our ASL interpreter. Nigel, thank you very much. You're a rock star amongst rock stars, and appreciate that. And to all of you who have tuned in and sent in your questions, heartfelt questions, I'm glad that Dr. Henry and Minister Dix were able to handle some of them tonight. Unfortunately, we're out of time. I'd like also to provide my thank you to all MLAs and all their constituency assistants around the province who are doing their best to help 5 million people understand what the rules are and how to get their businesses up and running, and how to avoid sharing this awful, awful virus amongst British Columbians. Thank you for bending and flattening the curve, and thank you for tuning in today. God bless all of you.
Thank you.